Hello everyone.
Hello.
Today we are together with Dr. Asena Paran, the medical director of Rumi Pulse Health Tourism Agency. Rumi Pulse is an agency can perform all stem cell therapies and operates in Istanbul, Turkey. Welcome,
Thank
doctor.
you. Thank you.
The majority of their patients are children with autism. I would like to ask the most frequent questions. I would like to start with the most frequent questions
Sure.
on this topic, actually. Uh, why is stem cell therapy recommended when it comes to autism spectrum disorder?
As you also know that autism spectrum disorder prevalence has increased tremendously in the world. Now we know that one of every 36 children is diagnosed with autism. Therefore, some alternative therapies, because it's not a disease, so we cannot talk about a treatment. We can talk about some therapeutical, let's say, therapies and alternative methods to improve these children's behaviors. That's why for about 25 to 30 years, stem cell therapies on autism spectrum disorder increased. The applications, increased. So, autism, I tell it like that. There is a formula race in the brains of these children. The stimuli flow. We talk, we think, we do some actions, and our brains are activated. And the stimuli is very fast in these children, faster than us. So they have a race, but there isn't any control. There isn't any traffic lights. The traffic lights are broken. Some cables are mixed up. So that's why these children may act different than us. They may have some tantrums, they may not speak, their social interactions are broken, and so on. The families who have children with autism would understand it better. So stem cell injections, the therapy, could repair this traffic jam and also could remodel the connections of the neurons, the brain. That's why they don't have any problem with the intelligence capacity, but they have problems with the flow of the brain activity. So stem cell may regulate this flow and also may improve their social interactions and speaking problems and so on. That's why it is recommended.
Okay, yeah, as you are the expert for this product and these stem cell issues, you're mentioning that it works for these
Sure.
children, but I'm really curious about. Actually, the questions are coming like that. Can you evaluate? Could you evaluate the results specifically for your patients? Do you have any evaluation
Sure.
related with your patients?
Sure. Our clinic has been implementing stem cell therapies for autism spectrum disorder for about 18 years. This means more than 3,000 cases, and we have an achievement rate over 97%.
97?
The positive feedback rates, and I may start with my son actually, because I'm a mother of a boy who was diagnosed 11 years ago. He was 2 years old, and my son was diagnosed with Asperger's syndrome. In those years, we can divide. They were dividing they were classifying the autism: Asperger's, typical, atypical, so on. But in the recent years, they only say autism. So when I was in medical school, my son was diagnosed. I was desperate. I was seeking solutions, and they told me, you just focus on your son and on his rehabilitation. And I wasn't aware what the rehabilitation was. So, and one of my colleagues, let's say, we were in the medical schools, they said that your professors are working on this field. They are doing something called stem cell, and they're injecting it to the children, and children are getting better. So we connected with our professors, and my son had this stem cell therapy around when he was 3.5 years. He's 30 now. He's out of the spectrum.
Oh,
Yeah.
great. Great to hear that.
Actually, it was a miracle because he wasn't speaking. He was having repetitive behaviors, and he wasn't very interactive with us. I was calling him. He didn't even never looked at me. So now he's a gentleman. He's in the 8th grade. He finished 8th grade. He will start to high school. After that, I focused on my medical career, let's say my student career, on autism, because yes, autism is a disorder, but very good promising results may be obtained, like my son. So my aim has become like taking the children inside this, from the spectrum out of the spectrum. That's my goal now. And in 18 years, our professors have achieved very good results. But I must say this first. This is positive feedback. We rely on positive feedbacks because you cannot assess it with blood work or any other imaging methods. You don't have these in your hand. That's why we contact with the families and we get their positive feedback results, and I say 97% of the families say that their children show improvement. So we are very happy with this result, and we know that at least we don't harm these children. We don't give any harm. They don't get worse. And we are happy when they get these improvements and achievements.
Yeah, it's great. I'm also so happy with your children also.
Thank you.
Great achievement, I think.
Oh, fantastic. Believe me, fantastic.
As far as I know, again, lots of questions, I'm receiving about it. As far as I know, there are some clinics around the world that perform stem cell therapy.
Yeah.
However, as far as I know, again, your methods are somewhat different.
Yeah.
Could you inform us a little bit about your system or your methods?
Sure. Yes, we are also aware of that. The families call us and tell about the applications of other clinics. They are doing great, by the way. However, since I'm a mother of a boy who was diagnosed before, I have a holistic approach to these children, because autism may have many causes. Some family can say my child was good and after the vaccination he has become like this, and the others can say other reasons. Some hypotheses say that parasites may cause this, toxins, heavy metal loading. Many parameters are discussed when it comes to autism spectrum disorder. Therefore, our protocol includes the follow-up, longer follow-up, up to 3 years, and also
Up to 3 years.
yeah, sure. We don't leave the families as soon as they don't leave us. So we like to keep in contact with them. We like to keep the progress, to see the progress of the child together. And also we apply a detoxification program. Even though they don't have a heavy metal loading, they have a detox program to get the toxins out. That's very useful. I think every human being should have this at least once a year. We also apply an anti-parasite program and bowel regulation program, which is majority of these children have some kind of gut problems, leaky gut problems, constipations, and many more. So we have also a program to regulate this. We also give some supplements to improve their immune system and to improve their brain functions. These supplements include many vitamins and minerals which are essential for our body. And also our dietitian, who is experienced in autistic children for about 13 years, we prepare a special nutrition program. We have some recommendations for the families. Majority of the families know that, but we say that please try to adopt this in your whole family, at least your child, because we know that chips, packaged food, processed food are toxic for these children. That's why we are very
For all children.
for our children actually, but these children may be affected much more dramatically than when we compare other children. So we try to keep a holistic approach and we try to follow these children as much as possible. And believe me, in every positive feedback news, we get very, very happy, and our team are getting happy. Wow, from UK, a patient from UK or a child from UK, she starts talking, for example. So we get very happy with these results.
Yeah, I heard kind of information from the sales consultant from your company.
Yeah.
You know, a child start to talk with his father. It's kind of fantastic issue, you know.
Really, believe me, and I cannot think about what the parents feel, but we get very happy with this.
As you mentioned, you provide service with a holistic approach.
Yeah.
As I understand and from your speech, what kind of steps should those who want to receive this service follow? What kind of services?
Yeah, first they will contact with our patient consultants. They are very experienced in this field. And we ask if the child is diagnosed in the country, it's very important in his or her country. We want the reports, the diagnosis reports, the speech reports, any kind of medical documents are appreciated for us. We also ask some videos in order to assess the child. But if the child is not diagnosed, because we know that in some European countries and in UK, we heard about that, the process is slow.
Maybe takes 2 years.
Oh yeah, they're saying that they have appointments after 9 months.
Yeah.
But it is very important because autism requires not to lose time.
Yeah.
You have to be quick, you have to start the rehabilitation. And our country is very experienced on this. We start the rehabilitation as soon as the child diagnosed. My son was 2 years old. And in many countries, they don't even assess the child at 2 years of age. So if the child is not diagnosed, we ask videos because we have a council, a scientific council, including our professors, our pediatricians, neurologists, psychiatrists, dietitians, functional medicine specialists. Let's say 8 to 12 doctors are involved. And we assemble meetings online twice a week. Let's say Monday and Thursday. We discuss the cases. We watch the videos. We talk about the children, and our experts, if they say that yes, this child shows some kind of signs of autism, we inform the family. We also give some tests, some internationally accepted tests to the parents, and we ask them to fill in. So after this, we inform the families. Our consultants arranged free consultations with us, and we speak about the progress. We speak about the procedure actually, what they will do, how it will go on, and after then we invite them to the country.
Great.
Yeah.
Actually, there are lots of questions coming to my mind, and actually there are lots of questions here. So seems we have to have some more videos, I guess, from now on.
I hope so. Thank you very much for your attention.
For this video, let's finish it.
Okay, and see you in the next video. Thank you very much.
Thank you very much. Really, thank you very much for your valuable insights. Hope to see you in next video.
Yeah, let's hope it. Thank you very much for your attention.
See you.
Bye-bye.
Bye-bye.